This is the fourth episode of the Nutrition Education and Racial Disparities in Health podcast from Holistic Matters. Today, our guest is Dr. Michelle Simon, a naturopathic doctor and the president of the board for the Institute for Natural Medicine. With Dr. Simon, we'll be talking about how naturopathic medicine embodies a systematic approach to health that is focused on finding solutions to unique individual problems. And at the heart of this approach is optimizing diet, lifestyle, and nutrition. In this conversation, we will explore the potential of the natural approach to health to making real, long-lasting changes in the lives of people who struggle gaining access to the highest forms of healthcare.
So I'm so excited Dr. Michelle Simons is with us today to have this discussion with you kind of around how you first got your start into naturopathic medicine and then how some of the programs that your group is working with in regards to the minority community. And so do you want to give us just a brief introduction on yourself and how INM got started and really how does that play a role in the greater naturopathic community?
Yeah, sure. Thank you, Sarah. Thank you for having me here today. And let me just start out by saying thank you all for doing this and having a focus on this important topic. I want to just say thanks to begin with. But so my background is I am a naturopathic doctor and I practice in Seattle, Washington. And I've been in practice for about almost 20 years now, close to. And my background actually is as an engineer. Like when I was a kid, my hobby was to take things apart and see how they worked. Like I was that kid that was always taking stuff apart and seeing like how I can put it together in a better way. My dad was an engineer. So I was interested in seeing systematically how the world works. And that drove me to become a biomedical engineer. I have a PhD in that. And when I finished that program, I realized for me that I was kind of at the wrong end of medicine. Like I had been trained to come up with very, I would say, expensive solutions to healthcare problems. So, which is great. I mean, there's a place for that. But my understanding about health and healing had evolved during that time. And my great uncle Louis actually introduced me to the concept of naturopathic medicine. He knew John Bastyr, who started Bastyr University out here in Seattle. And when I learned about the idea that, you can actually take a whole person, whole perspective approach to health and healing, and that the body has an ability to heal itself that you can facilitate. And then there's a medicine, there's a profession that actually dealt with that. I was really compelled to do that. And to me, actually, in the end, naturopathic medicine is the engineering of healthcare. Like we look at all the variables, and it's very person-centric. It's very solutions oriented. There's a therapeutic order, which is a systemized approach to how we treat the patient. And it takes every variable into account, which I think is a really smart solution, and I think that there's a place for every kind of medicine. But for me, naturopathic medicine was the place where I felt most at home.
This idea of, you were started as an engineer and that actually in the end, you're still kind of taking things apart, in your mind and finding that solution right through the therapeutic order.
Yeah, absolutely. And I get bored quick. And I think that's one of the things that I love about this medicine is every person that comes in is different. Like I can have patients in a row that come in with heartburn, but the treatment plan is going to be different for those 3 patients. It's not just a protocol out of the box. I write them a script or something, but I have to really assess like, why do they have this? And then try to uncover the real reason and then treat that. So that's super fun. It's a challenge every day and I just love it.
So can you give us how you started INM and what is INM and how that affects the naturopathic community as a whole?
Yeah, sure. Great question. So INM we are a nonprofit. It's the Institute for Natural Medicine. It's a 501c3. So our real purpose is public education. And that's our mission is to bring naturopathic medicine to a larger audience and let people know about it, teach people how to engage with natural medicine options, and then connect them to providers that allow them to achieve their health goals. So we work in conjunction with the AANP, which is the American Association of Naturopathic Physicians, as one of our partner organizations. And our goal is really to bring programs forward that really help people. And ultimately, the goal is to transform healthcare to include more of the principles of naturopathic medicine, which are diet, lifestyle, nutrition at its core foundation. So we look at healthcare as being a little bit upside down, really, because a lot of the focus and the bulk of the money is spent on pharma approaches and higher interventions, when if we look at across the population, we should be spending more time in diet and lifestyle and nutrition, where we know there's a huge evidence base to show that chronic disease, which is the bulk of our spending in America, is best treated through these lower intervention, more lifestyle approaches. But that's not where our current medical system focuses the bulk of its effort. And we'd like to change that and sort of change it so that it's a cost-effective approach, because our current healthcare system, as you guys know, is not really sustainable on the trajectory that we have going with regard to the money that we're spending and the outcomes that we're getting. In America, we deserve better healthcare, I think. I think we should be at the top of our healthcare outcomes, and we are not at the top, unfortunately. And we're seeing that our life expectancies are actually decreasing, which is it's not right. It's embarrassing for a country of this and knowledge, right? So we'd like to try to bring forth the evidence to show that the work of our healthcare system should be focused on helping people understand how their body works and make the choices that they can. Like, we know that diet is so important, and it's something everybody eats every day. Hopefully in America, everyone's eating every day. So those are the things that you can change. And if you know why you're eating and what the food does to you, you can make different choices, even in what's available, in your environment and in your community. And those are small changes that will really translate out to larger public health changes over time.
We know that in many minority communities, chronic disease is at an epidemic level, right? And we've seen that, kind of be emphasized more so in this last year. And, you talked about the ability to eat every day, but we know that many communities have these food deserts. And so I know you guys have some programs that you're working on to address that. Can you talk a little bit about what those programs look like and how they're working to address those concerns?
Yeah, sure. So one of the programs we have, it's a pilot program, public health initiative, and we're focusing it in a community in North Carolina. And we know that chronic disease is responsible for the majority of healthcare costs in North Carolina. That state alone is projected to spend more than $65 billion every year in medical costs. And they lose about $26 billion annually from reduced workplace productivity. So that's a huge amount of money. Like, if we could address that in just some small way, then we could sort of bring those costs down. 80% of a person's overall health is driven by societal and environmental factors and the behavior that's influenced by them, which is known as the social determinants of health. So our pilot program is to engage a small group of folks in a community in North Carolina that is in this area of it's like a minority health pilot project. And these are communities that don't have access to the highest level of healthcare, but they do have access to this education because we're going to bring that to them. So what we're doing is helping them understand how their body works, number one, what chronic diseases are that they're likely going to be headed towards because it's so rampant in that community. So diabetes, particularly, heart disease is another one, high cholesterol is another one. And then how to use food as a treatment for those diseases. So if we can bring this education across, then these folks will be empowered to make different lifestyle choices and be excited about the fact that they have the choice to do this and create a better future for themselves. So the data we will show, hopefully, by using food as a treatment, we will decrease their risk of heart disease, decrease their risk of diabetes, which, as I think you probably know, 1 in 3 Americans born this year will get diabetes in our country. Like, that has got to be an environmental lifestyle choice. Genetic change doesn't happen that quickly. So if we can address it from that perspective, that it is environmental and its choices, then we can probably start to bend the curve of that diabetes risk in this community. So that's our goal, is to bring the education forward, help them, show them how eating a healthier diet makes them not only have better health outcomes, but they actually will feel better. And that will be self-motivating in and of itself to continue this as a long-term plan.
Really, if you think about what you just described, Michelle, it's let food be thy medicine, right?
Mm-hmm.
If we really take back what we've known for centuries, we know that food can be our greatest healer, but it can also be our greatest detriment, right? And so we just have to find that right balance to help people make those correct choices, understand like how those choices are affecting the body.
Yeah, absolutely. And that's so the second program that we just designed to deal with this is working with kids, teaching kids about nutrition, and where our target is the fourth grader. Because if you get a fourth grader's like mind to change about something, the whole family has to adapt in some way. So our program is called Naturally Well, and it's a after school childhood nutritional education program that we deliver in an after school format. It's a little different now with COVID. We are actually moving it all online, but we had it be a 9-week program where the kids get together after school and it's hands-on. They get to make salads, they learn about food, they learn about reading labels, they learn to understand what sugar is and where to find it and why you don't want so much of it. And honestly, the kids love it because they get to like play with food and they get to eat stuff. And then they go home with this knowledge and they teach their parents about some things that they can actually implement there. So it's like a little lever on changing the community health. And I think it's one of my favorite programs that we have going. So that one, I would love to be able to partner with YMCAs all across the country. We've delivered this through YMCAs in California, and we have a partner called Esperanza in Phoenix where we're doing that this year. So we're hoping that we can develop nationwide rollout of this really cool hands-on program to start to change kids' minds about nutrition.
I love that it's fourth graders. I think fourth grade was my favorite year with my son because they're not quite sassy teenagers, but they're able to really make an impact on their family and what they've become themselves. So that's a really smart target age, I think. I love that.
There was I think it was an article I read years ago about Nobel Prize winners, and there's some sort of there's an age that they learned about their field of study, and it was like fourth grade is when they became aware of whatever it was they were super interested in, and that is what they kept working on. So I know it's a super fertile time for the mind, so it's a nice time to get that really healthy message about nutrition to those kids.
It's funny, Kara, you always ask the question, when did you become interested in nutrition? And I think, if you could become interested in fourth grade, I might've been just slightly after. Seventh grade is when I determined my career path. So maybe it was in fourth grade. Maybe I'll win a Nobel Prize. That would be awesome.
So Michelle, just a follow-up question to, the program that you mentioned with kids and the previous one. Yeah. Can you speak to some of the obstacles that you faced when trying to implement these types of programs, and what type of support have you gotten from the wider communities, other businesses, or other organizations? Is there a path that you could follow if other people were trying to implement something like that?
That's a really good question. And obviously, finances are a stumbling block for bringing forth any program. So you have to find partners who are willing to invest with you on what your mission is. And we've been successful at that by looking towards family foundations. There are a lot of family foundations that are interested in changing the way the world is. And that's who's been funding Naturally Well, is one wonderful family foundation called IBIS out of Phoenix, Arizona. And then another group was a hospital foundation, actually. So there are groups out there that are interested in making a difference. And you just have to be able to find them, speak to what their mission is, and align that way. But that's the hardest part of this. And once you have the funding, it's easy to find partners that want to work with you to deliver the programs. So we're working with Esperanza, which is a community health organization that is also in Phoenix, Arizona, and they work with primarily Hispanic community members, and they're bilingual. So it's really helped us to have their participation, because what we're doing is we're creating a gamification app also for the Naturally Well program, because we're going online with the whole thing. And they're able to work with us and actually do the translation to get this information into a native language so that everybody can access it in those communities. So finding partners that have specific skill sets in what you need is really helpful too.
What is the interest or the level of involvement in health and wellness companies? Have you seen an interest in types of companies like that? Because, to me, when you talk about missions, aligning, and all of that, I think the overall mission is to, change the way healthcare is. And that to me is the ultimate mission. So finding companies that align with that, I think would be a lot easier, especially if, they're a health and wellness company or there's some of these different organizations. So I was just trying to get a feel for what, the responses are with health and wellness companies. Have you partnered with them? Do you think that is something that, would be a good area for more companies to be able to support programs like that, put their money where their mouth is, in a sense?
It's what I do every day, honestly, as I look for partners that are in this sector, that are interested in creating and really creating health, and not just creating a business around health. Because if you create the story such that, when you make people healthier, they make different choices, and they will engage in businesses that are adding to their health. So for me, it's a rising tide that lifts all boats. So if we have success in the health of the community, the businesses will also succeed, and the partners and the organizations that are bringing forth these programs succeed. It's a win-win-win kind of arrangement, honestly. So, and once you have that conversation with the right people who understand that it's not just, philanthropy, throwing money at something, there's actually a benefit to it. There's a return on the investment, because creating a healthier community creates more success for everyone.
It's really hard to fathom why people are not understanding that connection and the return on the investment. And I think that goes for a lot of different things in our society as a whole. But just on that one point, if you're running a health and wellness company and your goal is to put products out there, unless you're not really trying to help the community, partnering with programs like that and being able to support it, I think would be or should be a huge part of what the organization is pushing for, participating in. So just trying to get a sense of other than the foundations you've worked with, if actual food and health and wellness companies, are they willing to participate? Have they been approached? What is the response from them? That sort of a thing. Because it goes back to what you said, that if everybody in the community succeeds, so does the business. But I don't know why people don't see, or they think that doing that is negative or is going to impact the business negatively in some sort of a way.
Yeah, it's work. It's a lot of work actually to get this message across. And I think that there's an old model of business, and that's changing. Honestly, even nonprofits are changing. I think the future of nonprofits is more of a blend between straight philanthropy and sort of a win-win-win, like I'm talking about. There's revenue generating that can be beneficial to a larger community, and still there'll be benefit to the company individually, but it will be shared across a larger social network. I do think that that's the future. I still think it's just the old model, and that is going to change. We're recognizing that all of our cells are connected, all of our people are connected, our economies are connected. So that is something that is eventually going to break free, when you recognize that if you can work together, like in the naturopathic profession, one of the things that INM does is that we bring together almost 80 stakeholder organizations to communicate, to start to collaborate. And this is the process that's been going on since 2014. It's not an easy thing, because we think so in silos, but if you can work together across communities and across organizations, and then start to share, like your overhead, so that you can work together, that decreases the cost and increases the impact. And that has to happen across companies and across sectors as well. It's starting to, but it's just, you're right, it's actually quite slow going. And there's been a lot of studies that have shown that the younger folks, millennials and younger, are interested in working with companies that actually have a positive impact on society. Like they're less motivated by the strict financial gain of a job. And I think that's a shift that's going to just change the whole way business is done and is in America and beyond. And I'm excited about that.
Yeah, and if anything, just to add to that, the pandemic has shown us more often than not why that is even more important right now. It's, put so many things under a microscope, good and bad, and it would be a wasted opportunity for, in general, people to not notice and try to do better, in light of everything that's happened in the past year.
You're so right about that. And then just to tag on to what you're saying, we notice on our website alone, which is naturemed.org, we're getting a lot more traffic, and it's organic traffic. People are looking for answers on how to improve their health naturally at home. What can they do themselves? Because health is number one on everybody's mind right now, and some of the conventional strategies maybe are falling short because there's a lot of people that are still getting ill. And they want to know what else they can do to help their immune systems, for example. So this is the time people are paying attention, so let's give them the information.
How do you think naturopathic medicine, or like a natural approach to health, as opposed to what some people may consider a more conventional health care, how would the natural approach help communities that traditionally haven't had a lot of access to nutrition education and are struggling with these chronic health issues? How would that help them more so than maybe this more conventional approach to healthcare?
Great question. I think that naturopathic medicine has to offer this, what I mentioned before, which is therapeutic order. And it is a systematized way of looking at the body and how to heal it. So it's ordered, it's structured, and it starts with diet and lifestyle nutrition, like understanding the basics of your health. Before you get into what should we do about this disease state, we first want to understand, why is this disease state there? Why did the body allow this to happen, essentially, or what was contributing to it? Perhaps this person was having a really hard time sleeping and their immune system got impacted by that. So we need to look at the basics, like, are you eating well? Are you drinking enough water? Are you sleeping well? Are your relationships healthy? Are you, socially connected? There's all of these things that determine how vital our bodies are and how our immune systems respond. And it isn't always the place to start. Sometimes acute things need to be addressed before you go back to this layer. This is foundational layer. But it does always have to be addressed at some point. And I think the conventional system doesn't provide enough focus or priority in those questions. Like when I go to see a conventional doc, I don't always get asked the questions that I think are like most important. Like did you have breakfast today? Like some simple stuff. And it's the things like, it's common sense care. It's the kind of thing that your grandmother would have asked you, like, did you have lunch? Is that why you have a headache? Did you skip some meals? Like there's some basics, not like, well, maybe you need to take a Tylenol because you have a headache. Mm-hmm. So that's a super simple example, but I think it's an important one. Like, we've gotten really good in America. We have some amazing healthcare that allows us to do fantastic things, but I don't think it can be to the exclusion of some really basic stuff. And I think the basic stuff can really bring the cost down, because if you're dealing with folks on that level of diet, lifestyle, nutrition, are they exercising? Like, exercise alone could solve a lot of things for people, just get them moving. So I think that that's what naturopathic medicine focuses on. And the other thing that we do really well is we meet the patient where they're at. Our visits are generally, like, the first visit is about an hour, and we really get to know those folks. And when you're asking someone to change their diet or to start a different lifestyle, like, you have to have a connection and a relationship where they're going to be motivated by that relationship. It's that therapeutic relationship that gets things to change for people. And if you're only meeting them for 10 minutes, they're not going to really probably take your advice on, yeah, you probably should cut out like gluten in your diet because you have a lot of inflammation. They're probably not going to do that. But and you need to have that relationship to be able to explain why, like to motivate them. And that takes time. That's an investment of time. And that's why our type of medicine is, it doesn't reward the practitioner with a lot of financial benefit because we can only see maybe 12 patients in a day, which isn't a lot, but every one is a pretty in-depth appointment and a pretty meaningful interaction. So that's why it's fun, because you actually get to meet people where they're at. And like, I have a lot of patients that I have to actually bring forth the research. They want to see the evidence, and I love doing that. And then I have other folks that are more on the emotional spectrum, and they really want to understand, like, what is the benefit to me personally. They don't really want to see the evidence so much, but they want to understand why they have to do this for a more emotional reason. And you need to know who you're talking to, who that patient is, and how to motivate them. And that takes time. That's a relationship. And that's one of the great benefits of this kind of medicine, is that we get in there, we delve in there, and we really understand who we're talking to.
I think that the more I hear someone like you talk about the natural approaches to health, and the more I work with Holistic Matters and talking about holistic health and nutrition, I get more and more upset that naturopathic medicine isn't credentialed in North Carolina, where I live. And thinking of that, I wondered if, for people who aren't familiar with naturopathic medicine, if you could talk a little bit about the different states that the practice is credentialed in and what that means for states that are or are not credentialed.
All doctors are licensed by their state. So that is a state level decision for medical doctors as well as naturopathic doctors. In naturopathic medicine, we're not yet credentialed or licensed in all states. We have 22 currently that we are licensed in, which means we can practice medicine in those states. Even within those states, there's some varying scope, which means, for example, in California, they don't prescribe medications, whereas in Oregon, Washington, Montana, Arizona, we have pretty close to full prescriptive authority. So we can write scripts for folks, which allows us in those states to serve as primary care providers. In Vermont as well. And in Vermont and Oregon and Washington, we also take Medicaid, which is a state level program. So, but that is only those 3 states. So there's a lot of variability depending on where you live in the country with what kind of access you have. And in states that are not licensed, you can call yourself a doctor, a naturopathic doctor, but unfortunately you have to have graduated from a school that's accredited to be able to say that with authority. You should always check if you're wanting to see a naturopathic doctor, like make sure that they actually have graduated from one of the accredited schools. And you can check either on the AANP website, which is naturopathic.org, or on our website, which is naturemed.org. And we have a Find a Doctor tool there. And all of the doctors on that website are licensed, accredited, have gone through the 4-year, and have passed their board exams. So I think it's important for the public to know that there are ways to determine whether a naturopathic doctor is a truly educated and trained into the discipline and has gone through that 4-year postgraduate program.
I thought when you said that, describing healthcare as upside down and how often people need to spend more time in diet and lifestyle, nutrition and exercise, I thought that was a really interesting way to describe it. And also was thinking that in a lot of ways, for people who are maybe visiting your office for the first time after a lifetime of visiting very conventional MD type offices, they might be in some ways, pleasantly surprised at these different approaches, these more natural approaches they can take to improve their health. That may seem easier, but on the other hand, some things may seem more difficult. So like going back to your example about the headaches, someone might see that it's easier to pop a pill as opposed to staying hydrated or, remembering to eat, their lunch that day. What challenges or what reactions do you see from people who are first learning about naturopathic medicine, and what challenges do they face when they're kind of changing their worldview as far as their healthcare?
And just before you answer, Michelle, to add on to Kara's, what preconceived notions do you find yourself typically having to overcome?
Those are great questions. So I'm going to use the example of a husband that gets sent to me by his wife. So that happens more often than you might think. And the husband comes in somewhat reluctantly, like, okay, I'm here because my wife made this appointment, and they're not bought in, right? So the preconceived notion is that I'm going to send them home with a bag full of supplement bottles that they have to start taking on a regular schedule. And the questions that I ask are more like, what do you want your health for? Like, what is it you want to achieve? Why do you want to be healthy? And then they have to really think about that, and the questions are more designed to elicit what's unique about that person and their health challenges, and what they think has brought them to this place. Like, why are they not as healthy as they should be? And like that discovery process opens something up in people generally. And they start thinking really about their own personal health journey, where they've gotten to, what it delivered for them, and what they really want to achieve now. Like, if they were totally free from disease, health is not just the freedom from disease, but it's the opportunity to achieve whatever your goals are. Like, it should be a tool for you, and so that you can do what it is you're here on the planet to achieve. And understanding that the choices that you've made in the past sometimes have longer term consequences. We see that taking Prilosec, for example, for a long period of time can result in thin bones and osteoporosis. So there are downsides to some of the conventional approaches, and understanding that if you figure out how to solve whatever that issue is, finally and for good, because you've solved the core problem and the root cause of it, if you can, then you're freed up and you can have this optimal approach to the rest of your life. And it's about that trajectory, that health trajectory, that preventive kind of strategy for the next decades that you're on the planet for. That's why we're doing this. So if you can get that message across, people are generally a little more interested in understanding how they can optimize their health for the long term, and for their family's health too. It's not just about the individual, but it's the connection to everybody in their lives that's impacted by their health.
I would like my own experience of going to the doctor to be more like that.
Yeah. No, that's really true.
Yeah, I hear you. And I hear that all the time. Like, wow, I've never had these questions. When a new patient comes to see me, like, no one's ever asked me this stuff before, and people love that. People love to be able to just take a reflective look on how they got to where they are in their lives, and understand how they can make choices now that will change the course of their health for the next decades. And I always say that to moms that come in. They often are super fatigued and tired, and they're doing so much for their families. And it's like they're, with the sheer force of their will, with their brain, they're just dragging their bodies along behind them, to get to this point. And you have to change that mindset. Like, you have to put yourself first, because your health impacts the health of everybody. And you want to teach your family that taking care of their health matters, that mom's taking care of her health because it matters to the rest of us too. That training is really important.
Yeah, because mom cannot pour from an empty cup, right?
That's exactly right. Yeah, for sure.
I think that's that point, and especially the point about mom, they become kind of the health authority, right, for the family. How do you help them, and especially maybe a working mom who's got kids and kind of living at that edge of living wage, to think about her health first and the health of their family when they're, sometimes struggling?
Yeah, that it is a challenge for sure. But what we have to assess is that person's individual situation, and like really take stock of the resources that are in existence already, understand what her concept of nutrition and diet is, and then make choices for her diet that are most beneficial within the available network of stuff that she has access to, right? So are you getting enough protein? You need enough protein to make sure that you balance your neurotransmitters, because you make those from amino acids, which come from protein. So sometimes just a simple explanation of how you help your mood through food is really helpful and beneficial to those folks, because then they can make choices between this or that food or dinner choice. And one of them, the message is in the back of their heads: if I have this will give me protein and I'll probably have a better mood afterwards, versus having just a carbohydrate, which is going to leave you craving other things and your blood sugar will be higher. And if people understand those choices, they can make different empowered decisions about their diet, then start to feel better. And once you get someone starting to feel better, like just give them a couple things to do, that starts the snowball of engagement. And that starts that therapeutic relationship where they trust you more and they'll be engaged and they'll do more things that you ask them to do down the road.
And that really resonates even with me as a mom too, that often puts like self-care, because I do put this kind of health in that bucket of self-care almost. Because, we're always thinking about how can you take better care of your family or how can you take better care of others, but really you have to start with yourself. And if you feel better, to your point, Michelle, it's kind of that, trickle effect. You're feeling better, you can take better care, you can do more or, be more efficient. So it really is like a win-win all the way around. And I think that message of, those little small things that can be done really do make a huge impact, but they have to really, invest in themselves as well.
Yeah, absolutely. And then once they start to make those changes, you're right. We can continue to layer on, like, let's look at your digestion and how are you sleeping? Are you moving at all? Sometimes I ask people, can you spend 1 minute doing some air squats? If you just start to create a habit, it takes 21 days for a habit to set up, and you can break a habit in 3 days. Like, it's really hard. Habits are difficult to create, but if you make them small enough, they can start to do that and then gain confidence and be proud of the fact that, yeah, you know what? Every day this week, I actually took a little walk around the block or something, something simple. And it helps them gain confidence in their ability to make a difference and make a change in their lives.
Well, this was so impactful and helps us really understand that funnel and understand how naturopathic medicine can have an approach in all communities. And I know I'm going to do some air squats when we finish this. So
awesome. My work here.
Thank you so much.
You're very welcome. It's been so fun. I enjoy talking with you guys.
Thank you, Dr. Michelle Simon, for this important conversation about naturopathic medicine, and for teaching us that health is not just the freedom from disease, but the opportunity to achieve whatever your goals are. For more about naturopathic medicine, visit naturemed.org. And for additional nutrition education, visit WholisticMatters.com. That's holistic with a W.